a lot of the issues that the palliative care people are looking after can be looked after for quite some time in the general practice setting. So I think they can play a really big role in that.
The best role that primary care could play in decreasing the burden of the palliative care services is education, learning about what palliative care actually means and what it is, and knowing how the services can be accessed, but also what's an appropriate referral. Also, what are the other services that are alternatives that might be just as suitable, if not more suitable, for individual patients. And also it would really help to decrease or try and get rid of the taboo around even just the word palliative.
I think for primary healthcare nurses to be aware that the majority of palliative care is actually done at home in the community, but being really in touch with where the person's at in their disease trajectory and understanding what they need to be looking for as somebody's deteriorating, and being aware of the signs of deterioration, and when is the right time to start having a conversation with someone about the progression of their illness and how to actually bring up the subject of palliative care, because I think a lot of people may end up unnecessarily bouncing back into the hospital system when they could be seen by the community palliative care service, and so that would decrease the burden of care on the hospital system.
I think the biggest issue around palliative care and palliative care services is the stigma associated. So I think a major role for primary healthcare nurses can be working with people affected by cancer, whether that's somebody with the diagnosis themselves or the carers, family members, about what their understanding of palliative care is, what palliative care can do, the fact that palliative care is part of the team, that it doesn't mean that people are being abandoned, but that palliative care services are part of primary care, they're part of hospital care, and we work together effectively. So I think that that's perhaps a major role, but it's also about working as a team.
For me, the objectives of general practice and survivorship care are that, one, nurses upskill in their knowledge about palliative care and survivorship and treatment of patients, that they increase their knowledge about the needs for patients in that domain, and that they realise that chronic disease management has a place to play in the care for these patients.
To start chipping away at the taboo of cancer is not really something that should be dealt with at the general practice level, and just to start getting nurses more comfortable with the idea of, look, this is something that I could help manage. This is cancer patients and cancer survivorship patients are some that I could really help. I could actually make a huge difference, and it's not that different to the care that I provide to other patients with chronic conditions.
General practice is quite complex care in that they're seeing so many different people with so many different problems, and I think a lot of the focus is on chronic disease management in general practice, and so I'd like I guess general practice to make sure that they see cancer in that chronic disease management sphere.
The primary goal is better care for patients. It's quite easy, if you come back to why are we doing this, we want to bring about better care. But recognising that primary care has a really important role and trying to work out how do we work most effectively. In a situation where it's a very constrained, we have limited health workforce, so we have to use the health workforce as effectively as we can, and work with community-based organisations too, which are often not twiddling their thumbs, but they have extra capacity. So it's how do we actually work most effectively for the benefit of people affected by cancer.